Good afternoon. Welcome to today's webinar on smart dental materials from antibacterial therapies to tissue regeneration. I'm Dan Lemire, the Executive Director of the Society for Biomaterials. Before we get started, if you have any questions, please type them into the questions pane and we'll do our best to address them at the end of the presentation. A recording of this webinar will be available on the SFB website in the next few hours by tomorrow at the latest. Without further ado, please allow me to introduce Daniel Harrington. Dr. Harrington is currently an associate professor in the Department of Diagnostic and Biomedical Sciences at the University of Texas Health Science Center at Houston, holds an adjunct appointments at nearby Rice University, and serves as a senior scientist in the Houston Center for Biomaterials and Biomimetics. His research involves 3D cultures and matrices for both regenerative medicine and lab-on-a-chip applications. He currently serves as Secretary-Treasurer for the Dental Craniofacial Biomaterials SIG and Industry Representative for the Engineered Cells and Tissue Microenvironment SIG in SFB. Dan, take it away.
Thank you. Good morning, everybody. I'm excited that you're with us for this exciting talk today. I'm happy to introduce Professor Santiago Orrego as today's webinar series speaker. Dr. Orrego has made scientific contributions at the intersection between materials science, engineering, and dental materials. Specifically, his work encompasses the development of antibacterial, regeneration, and self-stiffening technologies for dental applications. Moreover, Santiago has studied the fracture and fatigue properties of mineralized tissues such as dentin and bone. Currently, he's seeking to translate the use of smart materials into the biomedical field for the improvement of health. His talk today is Smart Dental Materials from Antibacterial Therapies to Tissue Regeneration. I hope you'll join me in welcoming Dr. Orrego for his talk today. Please take it away.
Thank you very much, Dan, for the kind introduction. It's really an honor and a pleasure to be here speaking to all of you. And thank you, Dan, for the invite. It's again an honor to be part of the Society for Biomaterials, and thank you for the giving opportunity to present some of the research work we're conducting in our lab. Today's talk is going to be broken down in 4 main areas. First, I'll talk about antibacterial technologies. Second, I'll talk about remineralization technologies. Third, about self-stiffening, and fourth, I'll finish up my webinar on self-healing materials. So I want to begin my presentation showing you this skull found in Aztecs Indian tribes back in Mexico. And this corresponds to 2,000 years ago. And as you can see here, dental materials have been used since the Indian ages, and they use a stone of jades, which are showed here in green, as in 2 purposes. The first purpose, they use it as aesthetics, and the second purpose, they use the stone of jades as prosthesis. So the Indians knew what they were doing by utilizing biomaterials that were available in nature to be able to improve the tissue function. So it's quite exciting that since 2,000 years ago, us as humankind, we're able to begin using biomaterials to improve our health. We're currently in a very exciting time in the biomaterials world, because thanks to the multidisciplinary work that has been conducted, merging biomedical areas, engineering area, and material science, all of those areas come together as a single area to manufacture and create biomaterials that can really interact in a very controlled and desired way with a lot of biological processes, such as interaction with bacteria, bacteriophages, viruses, cells, and so on and so forth. So we have reached such a high quality of control of how the charge of biomaterial, how the porosity of a biomaterial, how the ions, how the wettability, and how the chemistry, how all of those cues and features will interact with all the microorganisms that are in the human body. For example, easy and a very applicable approach is just by simply controlling the porosity, bone cells are able to grow more bone or less bone, just by simply controlling how the scaffold architecture is being held. So it's a very exciting time to be actually developing this type of biomaterials, so we can improve the interaction between all of these factors and the cells to obtain a better and improved outcome of the medical process. So before jumping into the research, I want to define what is a smart biomaterial, right? What we oftentimes hear this term of smart. And we recently submitted a review paper, and we propose a basic definition of smart biomaterials. And we actually categorize a biomaterial to be, has like 4 different degrees of being smart. The first degree and categories biomaterials are inactive. This is the lowest degree of smartness. And in this case, biomaterials are implanted in the body. They don't really elicit or do any a specific activity. They just go into the body and they remain passive in a way into the biomaterial. The second category is defined as passive. In this case, the degree of smartness in this case of this type of biomaterials is once you put them inside the body, once you kind of activate them, they begin to release any type of therapeutic and any type of drugs. So as you can see here, right, the yellow point, let's say, is a drug. So once you put the material inside the body, the drugs begins to get released automatically into the body. But the challenge here is that there is no really control and dose of the release of these medications. So that's the second category of passive biomaterials. Now, if we keep increasing the degree of smartness, the third one is called responsive or bioresponsive biomaterials. In this case, materials not only release a therapy or a drug, but also they have the ability to sense. So now, right, we're beginning to see that these biomaterials begin to get smarter and smarter. So you can think in this type of category, biomaterials have like 2 actions. One action senses, and they sense a stimulus. It can be external or internal, can be heat, can be pH, can be temperature, can be magnetism, can be any clue or any feature that they can find in the environment inside the body or outside the body. And once the biomaterial senses that stimulus, that tells that it's time for the biomaterial to release the therapy, release the drug, release the treatment. So this type of category is called responsive or bioresponsive biomaterials. And now the 4th degree of smartness in biomaterials, which is the smartest we know to date, is called autonomous. In this case, the biomaterials not only sense an external stimuli, not only releases a therapy, but has the capability to adapt to the environment. In other words, imagine in a first scenario, you have a biomaterial that senses one stimulus, and it releases a specific amount of drug or a specific treatment based on that stimulus. But in other occasion, in another scenario, the same biomaterial already implanted can sense a second stimulus and then release a different drug. So you can imagine, for example, biomaterials that can sense microgravity. So if you are in Earth, all right, you can release a specific type of drugs, but if you go to outer space where the gravity is different, then you can release a different type of drug, right? So materials that constantly adapt, also materials that are patient-specific. We all have different immune systems, and material can also adapt to this different immune system and deliver with precision medicine the therapies that the biomaterial needs to deliver. So after making that definition, this is going to be the outline of my talk. First, let's touch on the antibacterial biomaterials and what have we done from our lab and our collaborations to advance the field on this regard. Then we're going to jump on remineralization biomaterials, then self-stevening, and then self-healing. So let's jump into it. So why do we need actually antibacterial biomaterials? So what you see here could be a common picture for you. Is a tooth that has been exposed to caries or cavities. In this case, what happened is that bacteria actually was able to grow on the surface and actually was able to penetrate the dental tissue. As a result, right, the tissue gets wear out, and the bacteria actually generate acid and they wear out, they create holes and cavities. And the way we fix that in clinic is actually by removing the affected tissue and then replace it by dental materials, right? And as you can see here, this is the before and this is the after the cavities have been repaired. Now, if we look at these biomaterials, resin composites, which is one of the highest biomaterials we use for these procedures, they're called composites because they're comprised of 2 main ingredients. The first ingredient are resin matrix of resins, and the second ingredient are fillers. Generally, these resins are methacrylates. These fillers can be glass, ceramics, and fillers, right? The combination of those 2 they form the resin composites. So these materials are very attractive for dentists because they can control very nicely the color, the shading, the mechanical properties are suitable. They are light cure. They have a lot of benefits to be employed in clinics. But they have a big challenge. They have been shown that 50% of these implanted restorations, they usually fail within 7 years. So if I get one restoration today, 50% of those will fail in 7 years, which is a high rate compared to amalgam or the grace restorations we're used to, which tend to last 15 and 20 years. And more than that, the clinicians are spending more than 50% of their time fixing these old restorations. So once you fix them, they all get a secondary caries, and they fail again. And we're trying to understand why, and we're trying to make materials that actually overcome these problems. So this picture I'm showing you here actually highlights the problem very nicely. So what you see here is a cross section of a tooth, right? So if you imagine you have a tooth, you cut it in half, you're gonna have two main tissues. So you have a dentin tissue, and then you have the composite, the material that we use to restore that affected region. And what you see here in green is a bacteria that has been stained with green. So live bacteria that is live, is viable. And the red color you see here is bacteria that is dead, that is no longer viable. So the most interesting finding about this publication back in 2016 was that they showed that the bacteria was actually able to penetrate the interface between the dentin and composite. And this is quite critical because there is no tool or no hygiene technique that is able to remove the bacteria that it is already implanted inside this restoration. So the idea is if we make a composite that is able to repel and kill and prevent the bacteria at that interface, then we can extend the clinical service of these restorations. Now let's look deeper on this bonded interface, right? So remember the picture I just showed you. So in this case, we have the composite material here. We use a glue, which we call adhesive layer, right? And then we have the dental tissue. We have dentin and we have the enamel. This is typically, this bonded material is called the bonded interface, right? We have a composite, the adhesive, and the natural tissues. But the integrity of this bonded interface is challenged, has three major enemies, right? The first enemy is bacterial degradation. So actually bacterial, they produce acids. So they get from sugar provided from food, they ferment that and they produce acids. And those acids degrade all the adhesive and the resins, they degrade. Also bacteria, they produce enzymatic processes, they produce esterases, and those esterases also promote the degradation of the adhesives and the composites. And more than that, these esterases actually give positive virulence factors for the bacteria, meaning they use this degradation as a way to feed themselves and actually upregulate. So they become more active and they actually increase the amount of production level, which leads them to produce more acid and leads them to degrade even more the restoration. So that's a quite big enemy that these restorations have. So that's why we're trying to make new adhesive and new composite to be able to prevent the bacterial degradation of these materials. Other two enemies that these interfaces have are the saliva. Is again more esterases produced and found in saliva that make the degradation of these materials. Also, there are some enzymatic processes, the MMPs activated in dentin, that are degraded when they're exposed to acids or clinical procedures. And more than that, the mastication forces, the cyclic repetitive forces that we found when we chew and masticate the food, they also kind of degrade the conditions, as well as the thermal changes, because we used to drink hot foods and cold foods and so on. So all of these three enemies really threaten the integrity of these three and four materials, and that's why the bond kind of weaks sooner than later, and that's why we see a reduction of the clinical service of these composite restorations. So let me highlight you what are we doing on this regard to prevent that. So in the dental field, let's say we have what we call antibacterial agents, and there are like three categories for that. So we have monometers, right? Remember that these resins are right? We can modify whatever is in the resin side. We can also coat and add drugs and medications to these resins. And also we can have fillers and particles that are antibacterial. So the monometers, the famous ones are the MDPVs, the quaternary ammonium is a classic one. as drugs and antimicrobial agents, we see chlorhexidine, benzyl chromium chloride, and filler particles that are antibacterial are zinc oxide. Silver is a classic antibacterial technology, copper, glass ionomeres, calcium phosphates, and chitosan, right? So people, right, this is a big menu of antibacterial materials, and people have used these since long time ago in a different ways, as monomers, as fillers, and as just drugs coating. One of the main limitations of these antibacterial technologies is first, they deplete, so the antibacterial effect doesn't last long. So right, if you have a filler, the fillers leach out, they just go to the environment, and they cannot withstand the long-term goals because they just wear out in a way. They have short duration. Other fillers and other antibacterial technology like silver, they have like gray color, and right, for aesthetics purposes, you don't want those biomaterials to be gray, so you want to keep, white or kind of gray to white. And as we begin to add in more antibacterials, we get to complex formulations. We again complicate the coloring and complicate the controllability of the properties of these materials, right? So we're trying to advance the field, and we're trying to make what we call functional or biofunctional biomaterials. And I'll explain this concept. So in this work was done in collaboration with Dr. Mello from University of Maryland back in 2016, and it was pretty exciting work because we actually proposed to combine we combined 3 agents, but with 2 different purposes. So we combined silver nanoparticles and dimethylamino hexametacrylate as antibacterial agents. So we got like 2 of that menu. We got 2 of those and put them as antibacterial agents. And then we added nanoamorphous calcium phosphate, so nanofillers of these calcium phosphates, which is the same mineral that we see in our teeth and our bone. And we put them together as filler in our composite. So we actually created a composite material in adhesives with those 3 ingredients. The second thing we did was to create what we call twin interface sample. And this configuration is quite attractive because you really replicate all the bonding conditions you find in clinic. So what we did was cut a piece of dentin. So it was a block 2 by 2 by 2. And then we added the adhesive layer exactly the same way we do it in clinic. And then we added the ball composite, which will actually replicate exactly what we see in clinic. And so this is defined as the twin interface, right? So we have the dentin block, we have, and then you have the composite and the adhesive. And that material, or that bonded material, was actually exposed to challenges. The challenge it was exposed was to 7 days on biofilm culture. So what we did was prepare the beam, right? Put it in a liquid culture of bacteria, multi-species. So we got saliva from patients, and then we begin to grow all of these species, and then we let them grow and form biofilms on the material. And after the 7 days, what we did was to assess how strong was the bond, right? How strong was the bond between these 2. This is what you see here in this left graph, right? In the y-axis, I'm showing here what we call the flexural strength of the bond strength. It's like when you glue 2 parts together, how much force you need to break that bond. That's what I'm showing you here. And then we tested 2 environments. The first environment for 7 days was a neutral solution with no bacteria, just as a control. And the second media we used was the biofilm, like the sample that were exposed to this culture of bacteria, and the bacteria was be able to produce this esterase activity and the acid activity and so on and so forth. And the 2 samples we prepared was one with no antibacterial agents, no acid neutralization agents, which is the purple group, and the green group is with the agents, with the antibacterial and the acid neutralization agents. So as you can see here off the bat is that if we keep the solutions, the sample in the control solution, so no biofilm attack, the bond strength are comparable. They look pretty much the same, and there is no significant drop. But if we put the 2 samples, the control sample, no agents, and the sample agents into the solution, we see that there is actually a significant reduction on the bond strength of the groups that had no agents. So that showed us that actually the agents were provided some antibacterial activity, and that was comparable to groups that were tested in this neutral solution. So that was kind of exciting for us because that showed us that these antibacterial and acid neutralization agents, they were doing something to keep up with the bond strength, which, thinking about clinical life, that will tell us that will improve the clinical service of these restorations. Now, to keep analyzing this process further, we went to the microscope, and then we were trying to understand more the mechanisms behind. So what you see here in green is bacteria, again, that is stained as bacteria live, stained in green, right? So all of this shaded green is bacteria that is live. This is the dentin, this is the interface, this is the resin. And bacteria that you see here in red is bacteria that is dead. So, right, if we compare the no agents, right, there's no antibacterial. With the agents, you see that with the no agents, there is a lot of green bacteria that is live, that is able to form the biofilms on the surfaces of the interface. But when you begin to add the agents, we see a lot of red, meaning that the bacteria were getting killed and were able, they were not able to produce the acids and do the processes. Now, if you look in the microscope, we see that interface, right, dentin, adhesive, and resin. You see that in the resin and the adhesive side, there is no clear distinction where is the resin, where is the adhesive. You visually see an increased amount of roughness, surface roughness. So it tells us that indirectly that the biofilm is doing something to that to those surfaces. Now, when we try to look for the same features in the agents, we see, right, resin, a very flat kind of polished surface. We clearly see the distinction with the adhesive, right? We see adhesive layer and resin. Tell us it was more clean. And all of these features, right, if increased surface is a potential for the biomaterials to increase the floss and increase the mechanical degradation and crack formation. So that was a very interesting work. Now, we wanted to increase the notch with the research we're actually conducting nowadays. And we wanted to propose not only biomaterials that exhibit antibacterial therapies, but at the same time, remineralization. And the idea of having agents that promote demineralization is not only prevent, right, as shown here, the formation of bacteria and the degradation by bacteria, but if we have biomaterials within the adhesive and composite that can bring calcium from saliva or can bring calcium from the dentinal tubules, that calcium can be form minerals at that boundary interfaces to help repatch and kind of fill the gaps that are created by bacteria demineralization or by incomplete bonding. So actually those two effects, we hope also is another strategy and mechanism to improve the clinical service of this. So to do that, actually we are making, we created a new filler and the new filler is made of piezoelectric materials. So piezoelectric materials are these materials that when they are stimulated by mechanical load, by pressure, or by any kind of vibration, they produce electricity. So you can think piezoelectric materials as let's say if you have an insole of your shoe, and every time you walk, the pressure of your body will generate charge. And with that charge, people have shown that you can charge a cell phone. In this case, we're using those charges not to charge a cell phone, but using those charges to first kill bacteria and prevent the demineralization, and second, to bring calcium from saliva and from dentinal fluid to form minerals and help us repair the patches. Advantages of this new mechanism is that we actually have externally controlled. So we can, every time we masticate, we activate the formation of the charges, and by activating the formation of the charges, we hope to kill bacteria and remineralize. And a second advantage of this technology is that we use only one filler, is only one nanofiller of piezoelectric biomaterial to obtain the two effects, so, which simplifies the recipes. And the third and a powerful advantage of this technology is that has a lasting effect. The piezoelectric charges has been proven they can give you 10 to 20 million cycles, which, right, if you translate that to clinical application, it will give you 10, 15 years of service life. So it won't deplete and it will give you extended durability. So to show that, what we did was to first, right, make our own resin. So we combined a typical BGMA, TGMA resin, and we added nanofillers of BTO, which is a known biocompatible piezoelectric nanofillers. We went to the microscope, we broke the sample, and we began to check all of the nanofillers that were actually in place, that they were evenly distributed. And as you can see here, the fillers, right, with the kind of highlighted, those are the fillers that are distributed in the resin, and the black background that you can see here, it corresponds to the resin. So it was quite encouraging. Something that we checked to have a very rigorous and highly controlled environment was first to check the degree of conversion. Right? We wanted to show that our polymers were very good cure, because it has been shown that if your polymer is not well cured, that's gonna upregulate the biofilm formation. That's gonna be like food, let's say, for the bacteria to be more to degrade the processes, and actually our new composite was comparable to that of commercial composites or composite we use in clinic, which was great. And the second check we did was the amount of charge we were generating, right? So here we see the load, we see charge, we see time. So, and when we show that every time we apply a mastication force, right, we generate a specific amount of electrical energy, right? And we try to quantify that by measuring the electrical charge. As expected, the commercial composite didn't have any charge generation, but let's say a group, when we added 10% of these BTO nanoparticles, we were obtaining a electrical charge of 1 picocoulomb. And so we were kind of verifying that our materials was, like, material preparation side was good to go before doing any microbiology. Now, the second step we did was to show that, right, this bacterial exhibits antibacterial effects. So what we did was to actually make a new biofilm growth model. And what we did was to prepare beams and to submerge these beams into bacterial culture, right? So we got Streptococcus mutans microorganisms. We picked this strain because first is acidutic, meaning produces acids and the esterases that are known to degrade the biomaterials. Second is the keystone organism that is found in dental caries. So that's kind of the key driver of dental caries. And second one, and the third one is because it's highly well-known and studied. So it's a strain that is highly understood by the community. So the new thing about this model is that, right, for the charges to generate, we needed any type of a stimulation, right? So we needed to put the mastication load. So what we did was to submerge the composite into a 3-point bending and apply this cyclic mechanical load for the duration of the experiment. And by doing that, we were generating the charges. And by doing that, we were expecting first to kill the bacteria, and as are we going to see later, to generate the minerals. And this model actually replicates closer a realistic environment, because that's exactly what is happening in our mouth. We're chewing these materials, for 200,000 to 300,000 cycles a year. Now, to evaluate the antibacterial, we conducted 4 tests. We measured the biomass of the biofilm. So we literally is like measuring what is the weight of this biomass. We also assess the metabolic activity, the metabolism that this bacteria is promoting, and we also counted the viable cells, and we did also some fluorescent microscopy. So here's some data to explain. Okay, so the first experiment we did was to put this new composite, the piezoelectric composite, under this liquid medium. But the first step we did was to not apply any load, right? Just dip it in this planktonic state of the microorganisms and let the biofilm grow. So we did that, and then the first thing we measured again was the biomass, and this is the bar plot here. The second thing we measured was the MTT on the metabolic activity, which is the second bar, and the third evaluation we did was the cell viability, or CFU. And then we normalized all of the response by the well plate. So our well plates were like our control. Every time we did our experiment, we grew the biofilm on the well plate, and we normalized all our results based on that. So that's why everything is normalized by 1. Now, if we compare all the biofilm, the metabolic activity, and the CFU between commercial and then our new composite, they're not significantly different, right? All of them are comparable and actually very close to the same amount of activity determined by the well plate, because everything is very close to 1. That was fine because there was no stimulation of the charge. Then we went to the microscope to see visually what's going on the surface of the material. As you can see here, right, the blue, so remember, the green shows the bacteria that is live, the red shows bacteria that is dead. And as you can see, it's a clear, in a 1.2 by 1.2 millimeter space, you see a clear and determined biofilm formation, thick. The thickness is around 30 microns, very evenly distributed. And if we measure the biofilm volume, it's around 28 microns to the cube. Now, if you try to look for the same features on the 10% BTO, we see that the volume of the biofilm is very close, slightly lower, not significant. But then we begin to see these isolated kind of areas compared to the commercial. But then we begin to see that it's a little bit thicker. So somewhat the bacteria was able to kind of form and colonize, but not as even and as nice as the commercial, which was quite an interesting result. Now, the second step we did actually was to activate the load, right? We needed the load to activate the charges, and we hope that the charges were actually be able to repel the biofilm, and that's exactly what we show here. So the first thing is stimulating the commercial with this mechanical load. We have the biofilm, the weight, we have the metabolic activity, and we have the CFU. again, very similar to that response of the well plate. And then voila, we have a reduction found in the 10% BTO that after stimulated. So there's a reduction on the biomass, meaning there's nothing to wait really. There was less amount of activity by the bacteria, and there were not really viable cells compared to the commercial. We did the same exercise. We went to the microscope, the fluorescent microscope, and see if there is any biofilm. Commercial again is showing a very nice layer of like roughly 40 microns of this biofilm. But then when we try to check for the same features on the BTO, right, there is none of that. You begin to see a tiny bit of live bacteria here and there, but there's pretty much nothing on that surface, which was very exciting. So we went to having a volume of biofilm from 30 down to 4, right? So it's almost like what, almost 10 times, less than 10 times, which is a great decrease on the bacterial activity. So great results. For the first time, we showed that with the piezoelectric charges activated by the mastication forces, we were able to obtain antibacterial effects. Now, something that we're also very excited to work is that these piezoelectric materials, they can also get activated, the charge generation can also get activated by acoustics, right? A lot of actually the pickups, the microphones we use for electric guitars, basses, and actually the ones we use for voice, maybe this one is one of them, they use piezoelectric transducers, right? The acoustic signals that you send, they are converted to electrical charges, and that's exactly what we're trying to do here. Use this acoustic way as a means to stimulate the composite, and then as you're stimulating, we generate the charge, and again, that charge can be used to prevent the biofilm formation. First thing we did actually was to measure if indeed, right, some acoustic signal we sent are around 450 hertz, which is kind of the peak found in human speech. So we simplified the method by just, getting one sound at the peak of the frequency, and then we put it in the liquid culture, and then we put a hydrophone and we put our material, and we were measuring how much charge or how much voltage we were measuring. So what you see here in yellow is the signals captured by a good calibrated, highly effective hydrophone, which is in yellow, and the ones actually measured by our piezoelectric composite are the ones shown by red, which is great. It's very comparable. We saw a decrease on the intensity of the voltage, but that's expected because our composite is not as effective, right? The translation, a power translation between the acoustic signal and the electrical is not effective as a piezoceramic, full 100% piezoceramic. And then we're beginning to conduct the same microbiology process, right? So we're measuring the biomass, we're measuring the metabolic activity, and this is what we're finding. So we have two groups. We have the commercial group, we have our piezoelectric group. What we see off the bat actually is that sound has some antibacterial effect only, right? If we do commercial only sound, it's a reduction on the amount of biomass, and it also has a reduction on the metabolic activity. And when we try to look for the same on the BT or the piezoelectric composite, we have a augmented reduction of the biomass, and we have augmented reduction on the metabolic activity. So sound by itself is antibacterial, but when we use these piezoelectric materials, we actually increase the antibacterial effect of these materials. Again, we're doing the same. So microscope, green is live, red is dead, right? We see some formation of these microorganisms in commercial with sound, but we see less and less when we do the same exercise when these BTOs or the piezoelectric composite are stimulated with sound, less and less bacteria. Exciting as well. This is ongoing work, and hopefully we can have the publication out pretty soon. So this is what we're doing in terms of antibacterial, right? Now, regenerations, as I explained earlier, right? These bioactive, and this is how people know it in dentistry, bioactive agents, the main goal here is threefold. So if you have composites or dental materials that are bioactive, meaning they form new minerals either at that bonded interface, and the idea for that is repair any potential patch or hole that can be created by either the clinical process that is not perfect, and sometimes there are gaps. So the idea is to kind of repatch them, or actually provide chemical bond. If you have minerals here and then you have minerals, there is a chemical bond between them, and you can increase the bond strength. Also to regrow the tissue, right? You want to regrow lost parts. And the third application of these bioactive agents is to neutralize the acid. Literature and the menu of these bioactive agents are, again, monomers. People live in monomers and mainly use cationic polymers, PVA, polypyrrole, polyethylene, lamine, different cationic polymers have been used for this purpose, and also some fillers, calcium phosphate fillers like hydroxyapatite, again, the same minerals we have in bone and teeth, and the famous bioactive classes. So different, again, the menu of these bioactive ingredients, is wide. Now, connecting back to the piezoelectric, right? Remember that in piezoelectric, we claim that we have this filler that generate charge, and the first idea was to be antibacterial. But now we also want to test whether this filler, also the charges are able to generate a mineralization, right? Remember that these cationic polymers, this charge drive the mineralization. So we're actually testing that. So how are we testing that? We're preparing the same composites, and in this case, we're not putting and submerging the biomaterial in a liquid culture of bacteria, but we're submerging this in a simulated calcium-saturated solutions, like in a fake blood or fake saliva type of liquid medium, where you can find a lot of calcium in liquid. And the idea and the mechanism behind is that if you have some charges, if you have some negative charges on the surface, those negative charges are going to attract the positive calcium. They're going to supersaturate, and they're going to have the formation of the mineral on the surface. And that's exactly what we're doing. So we do like a 7-day experiment in which we put the sample, we do the cyclic loading for 7 days. And after the 7 days, we assess how much mineral is formed on that surface. So the first thing we measure is how much mineral, and we get a profilometer and we measure the weight, right? So we have like 3 groups. We have the commercial as control. We have a group with 10% BTO, let's say low charge, and we have a 60% group, 60% BTO high charge. And as we can see, right, there is some inherent mineralization, and that's normal because these solutions are so saturated with calcium, so there's a mineralization happening in the solution, and they precipitate. But when we begin to get these charges, we begin to get an increase of these minerals, and as the more charge we have, the more mineralization we have. We're doing some visual analysis. So this is as SEM. You can begin the white things you see here is like layers and layers of minerals that are being formed in the surface. And if we do elemental and chemical analysis to these materials, we begin to see the peaks of calcium and phosphate, which are expected to find because, right, that's what we had in the liquid solution as the initial state. So it's very exciting that just by activating the charges, we're able to form these new minerals. Now, what we're trying to do is putting everything together. So we show from one end, we show that material can exhibit antibacterial, great. The second thing we did was material by itself can generate minerals. That's very great as well. But now let's think about application side, right? Are these effects really be seen to improve the bond strength? Because remember, if you go back to the application, we want to really extend the durability of these restorations. So again, what are we doing is getting these twin interface samples. These are very good because you have 2 interfaces to induce failure. So you can study, it's easy to study the mechanisms of stress. So what are we doing is prepare a liquid media that has 2 ingredients, has the bacteria that promote the degradation, has the mineral to help us repair and remineralize, and we're actually doing sucrose pulsation representing food intakes. Sucrose pulsation is very important because the more sugar you give to the bacteria, the more active the bacteria is, the lower the pH and the more degradation you have. Right, so we're trying to understand all of these kinetics, but we're trying to mimic closer to the environments we find in clinics. And just quickly show you here what we're seeing. This is very preliminary data, but it's very exciting. So here, what I'm showing you is a typical fatigue curve, which have the stress amplitude and cycles. So think about the x-axis being time, and think about y-axis being stress. And this is what we found back in 2016. So in other words, if you apply a stress of 5 megapascals, you can say that your composite has an infinite life, so you cannot keep applying any force and it will never break. But what are we doing now is load that bonded composite. We're loading with cyclic load in very low. So we're using 2 megapascals, which is 3 times less than that. So we're putting just a tiny bit of force, and at the same time, we're submerging this composite into this realistic media. And we're loading the sample synergy, right? So we want to see the synergy of mechanical degradation and bacteria degradation on the bond strength. And we're stopping the test at day 3 and day 5. And after stopping the test, we go and break the sample and we assess the flexural and the bond strength. So this is what we're seeing. If you prepare the sample in 0 days, you go and break that bond of that twin interface sample, you get a comparable between commercial and bioactive, you get a comparable bonding strength, right? And this is more or less what people have reported in literature, around 30 to 40 megapascals of bonding strength. But if you do like a synergy, if you do 3 and 5 days cyclic load under these bacteria attacks, there is a drop on the bond strength of the commercial, right? So we went to 30 down to 10, 15 megapascal strength on the commercial, and not as much to the bioactive, right? The bioactive is the ones that have the antibacterial, the piezoelectric filters. And actually, if we do 5 days, more time, more degradation, more time to exposure, we're seeing actually a lower degradation. And the bioactive actually showing good promise. It's showing that after 5 days, it's keeping the same amount of bond strength, which shows that, right, is the fillers, the piezoelectric fillers are doing something to prevent the degradation of the bond. So this is a fairly new model, fairly new data, but it's very exciting to show that these bioactive technologies in these in vitro models are showing promise to extend the durability of these restorations. We're beginning to conduct, fluorescence, this visual image. We're beginning to see that, right, if we think about the block, we have the dentin side, we have the adhesive, we have the bull composite. We're seeing that failure is happening in different locations. For commercial, we're seeing failure happening in the bull composite and the adhesive interface. For the bioactive, we're seeing that failure happening in the dentin side rather than the composite side, and so on and so forth. So it's very preliminary data, but it's exciting to see that some of the applications and the benefits of using these biofunctional technologies, antibacterial and remineralization, acting at the same time. Now let's move quickly to the self-esteeming biomaterials. So actually one of the challenges of having materials of this type of bond is that the mechanical properties, the Young's modulus of all of these materials are different. Dentin, the modulus of bond of dentin can be 20. The modulus of the adhesive is around 4 to 5 gigapascals, and the modulus of the bull composite is around 10. So there's a big mismatch of the modulus of those 3 materials. And that can also influence a stress concentration happening at that bonded interface. So we're trying to see whether we can have materials, bonded materials like adhesive and stiffness that can automatically imitate the stiffness of the neighbor material. So if you have a bonded interface, the main goal of these technologies that initially the stiffness is 4, but with time it will equalize and it will imitate the stiffness provided by the commercial materials. And the best material actually in nature that does that is bone itself. Remember that the more exercise, the more stimuli you give to bone, the stronger it becomes. This is the famous Wolff law. And this result from this publication shows that concept very clear. So this is the bone from these mice. In the x-axis, we have a micro-CT, so measures the bone mineral density. In the right hand, we have a final element model plotting the strain energy density. And the outtake here is, right, these guys found that there are some parts of bone that are highly stressed because they put this bone rat under cyclic loading for X amount of days. And they saw that this location of bone has a lot of mechanical stress. And with time, they found that this area actually formed. So they actually were able to track how much bone was formed with time. Right, the more stress you add, the more forms, the more bone formation occurs, and locations in which you have low stress, the bone resorbs. So that's the beauty about the mechanical properties of bone. So ideally, there is no synthetic material that can do the same. But if we think about piezoelectric materials, again, piezoelectric materials are materials that convert mechanical stress into electrical charges. And the electrical charges will deposit minerals proportional to the amount of charge. So there is a bridge that we're connecting with piezoelectric materials. The more mechanical stress you put, the more minerals you can potentially get. And that's exactly what we're trying to show here. So we actually had a bin of piezoelectric material PVDF, and we did cantilever loading because the beauty about this condition is that, that regions closer to the foundation, they have higher stress. Regions away from that foundation has lower stress, right? So as measured here, right, these regions of high stress, they have a high amount of charges between minus 500 to 500. In regions away from there, they have lower charges between 100 and less than 100. So it's great. Then we put this film into the same SBF mineral environment, right, with a lot of calcium ions available in the environment. And then we measure how much of that, again, the thickness, how much minerals we were depositing along the axis of the beam. And this is what we're showing you here. So we have mineral height, we have beam length, and then we have the stress. So we know that, right, closer to the foundation, we have high stress. Away from the foundation, we have low stress. And what we showed is that minerals closer to the regions of high stress are highest, and mineral away from those regions of high stress are the lowest. So we have actually a greater deposition of these minerals and it's proportional to the stress. And we actually came up with a mathematical relation that can connect, depending on how much charge you have, how much minerals deposit you're gonna get. So it's exciting. It's very similar to what bond does. The more stress you add, remember, the more tissue formation you have. I actually wanted to kind of replicate that condition. So imagine now that you have a scaffold, a piezoelectric scaffold that mimics somewhat the architecture of bone. It's like very porous, and then as you can see here, like fiber, again, piezoelectric mesh. And then we submerge this again into these saturated fake blood calcium, high calcium rich solutions. And then we apply force for a long time, 7 days, to activate the charge. And then we let the charge to drive and bring all the calcium to the scaffold and deposit. That's what the first thing we did, as usual, is measure the amount of load with the grade, then measure the amount of charge to show that indeed these scaffolds were producing load. And then what we did was to monitor the modulus change with time. So, right, if we y-axis we have modulus, in x-axis we have time. And as you can see, right, when we use a solution with SBF where we have the minerals, we begin to see that as time goes, the stiffness increases, right? We apply the load, stiffness increases. We stop the load, then we have a slight reduction due to the viscoelastic effects. And as we begin to increase the load again, the stiffness of our material will increase after reaching some plateau after 2 to 3 days, because there's no more mineral that can get deposited onto the surface. There's a saturation of materials. Whereas if we do the same test, but for water conditions, not solutions without calcium, we pretty much see a straight line on the modulus. There is no really change of modulus. So this is very exciting. They showed us that the more load we put, the more minerals we can precipitate. The more minerals we precipitate, we see a change of stiffness. And then we tried to understand why and how. So we went to the microscope. As you can see here now, the fibers are covered with the minerals. We see minerals surrounding the fibers. As you can see here, the red are the minerals, stained minerals, right? They really do a great job, like just surrounding the fiber. There's also some mineralization between fibers. Now, if you measure the residual stress, if you measure the stress strain after, we see that the red one is after mineralized. So we see an increase of strength, we see increases of modulus, and we also increase of toughness compared to a control that pretty much remains the same. It's very exciting results. Now I have 3 more minutes. I'm gonna breeze through the self-healing biomaterials. A quick change of gears here. The main concept here is that we also are using in dentistry materials that can self-heal. Now the concept was actually proposed by Scott White back in 2009. Imagine you have a crack, right? That's how materials fail, with cracks. And now imagine you have microcapsules that have healing factors, right? And you have catalysts that if you combine this healing capsule with the catalyst, they kind of repatch and reform. So as the crack forms, will make that microcapsule to burst, and that burst of the process will activate the polymerization. So we'll kind of repatch and rebuild and heal all of that crack. And by doing that, we'll kind of mitigate the crack formation and will improve the material service. And this is shown by this graph. You have performance, you have time. A traditional material, right, the more time it goes, the performance decreases. But if you have self-healing materials, you will expect that every time these microcapsules burst, you have an increase in performance, and with time, you can also have an extended. Typical healing agents we're using in dentistry, PUFs, we're using melanine modify and salinized silica microcapsules. So we're putting these capsules inside the resin composites, and people is beginning to show that actually this study was done by Dr. Arola's lab in Washington, they show that if they if they embed these microcapsules and they do the fatigue crack growth, dn over delta K, they show that you need less amount of stress intensity to initiate, and the cracks grow at a slower rate, meaning the fatigue crack growth material and the fatigue life is increases by 580%. So it's promising that these technologies are showing an increase on the fatigue life. Now, I want to close my presentation just by inspiring you people. There is a lot of different applications in dentistry that they need a lot of these smart biomaterials. Not only restorative dentistry as dental fillings, but think about endodontics, right? Material that are really in contact with the bone of the jaw, right? And these are actually the more criticals because these procedures are really like for all your life. Brackets and braces, right? You want to have a lot of antibacterial, anti-infections. Dentures, you have anti-candida, anti-yeast and fungal infections. Sealants, you want also periodontal regeneration and so on and so forth, right? So there is a lot of opportunities in the dental field to be working in this type of materials. Something I foresee, right? Also different applications. I also see biomaterials in dentistry as mechanisms to deliver drug. So think about like a bracket that you can put and it begins to release drug, and it will use the mucosa as a mean to deliver the drug to the mainstream and get delivered systematically. Again, materials that can be adaptable properties. We all have different, each tooth has different mechanical properties, and it will be ideal that our materials can adapt to the different patients. Oral biosensors, right? Imagine having like Fitbits inside your mouth that can keep you track on your fatigue, on your activities, on health diagnosis by measuring antibodies and so on, and multifunctional materials that can do, anti-infection, anti-inflammatory, biodegradable, and so on. So I hope you guys, take this with you. We are in a very great time to begin to smart and engineer these biomaterials that interact with the environment. I hope I convince you that piezoelectric materials, they exhibit antibacterial reminalization, and there is a lot of research and a lot of potential for development of these technologies to create new companies and startups. I want to finish my presentation. First, thank all my lab, hardworking people, Carolina, Mike, AJ. It's a lot of people is behind this data. It's not me. I'm just the face here representing and speaking on behalf of them. But there is a great team behind me, and I'm very thankful to all of them for their hard work. They inspire me every day to come to the lab. I also thank my advisors, my boss, my school that believing in me and the development of these technologies. I want to stop here. Thank you so much for your attention, and I would be happy to answer a couple of questions as Dan indicates. Dan.
Santiago, thank you. What exciting work. Really a pleasure to hear it. Thanks for sharing so much.
Thank you very much.
I look forward to be able to put together a talk with that much depth. That's fantastic. So we do have some questions from folks. First one is from Nicholas Fisher, who asks, I'm wondering if you can comment on the bactericidal versus seeming anti-biofouling behavior of the barium titanate.
Absolutely. This is a great question. So anti-biofouling is having surfaces that you can modify the topography of the surface to actually prevent bacteria to go and colonize. So imagine if you try to walk into a minefield, right? You don't want to walk into a minefield. So that's what bacteria will feel like. This is anti-biofouling material, but they don't like to walk into this topography because they will get burst, or they don't like it, right? They don't feel that energy to get attracted to form the biofilm. So that's biofouling. Bactericidal are biomaterials that change the DNA activity. They interfere with the DNA processes of the microorganism, like the piezoelectric actually. Piezoelectric activate these charges, will activate the reactive oxygen species and will kind of unbalance the microorganisms, and they cannot replicate DNA, and they just modify all of these replication mechanisms. So there are like two different ways to kill bacteria or to prevent bacteria. One is this minefield, and the other one is just messing around with the internal processes of the bacteria.
And it seems like Nicholas's question is the barium titanate, which behavior would you say it kind of favors of those two behaviors you just described? Or is it a little bit of both?
Bacteriostatic, yeah, I said, yeah. So we've shown, we have data, I didn't show it up. Sure, I think I have it here. I can, no. We have data showing, measuring the reactive oxygen species, and we show actually that we have an increase. So we're just messing around with all the, this one right here, yeah. So we're just, messing around with all the DNA, and then, yeah, it's a bacteriostatic mechanism. It's just the reactive oxygen species. That's the mechanism of these piezoelectrics.
Okay, super. Thank you. We have a second question from Nishant Kohli. It says, could you describe the setup that provides the stress while the bioactivity tests are going on?
Sorry, Dan, can you say that again? I just lost
Sure.
you for 1 second.
Could you describe the setup that provides the stress while you have the bioactivity tests going on?
Yeah, let me see if I have a picture right now.
It must be elaborate to be able to make it work.
Yes and no. So, so we have two. One, we have a commercial fatigue machine. So actually they sell commercially. They're a little bit pricey, but they're small enough that you can fit in the incubator. It's basically an electromechanical actuator that moves, back and forth, 2 hertz, whatever frequency, and they can respond to displacement control or load control. And what we do is just make a container, kind of a similar well plate, and then put it onto that actuator. So we can grow the liquid culture of bacteria, right? So imagine a container. That container will almacenate, store all the liquid culture of bacteria or any environment. It can be SBF, can be water, can be anything. It's a wet environment. It's small enough because, right, if you're doing bacteria, you don't want to have like a 3-gallon container, but we do, millimeter scale. And then you just tell the actuator to go in a 3-point bending configuration, 4-point bending, whatever you do. And then you kind of bring down the container with the beam inside to the actuator, the stroke, and then turn on the machine, whatever load you want, whatever frequency you want, and then that's how you obtain. You're welcome to email me, and I can send you pictures and take pictures, and I hope we inspire. And we also make our own. So we go the cheap way and we buy the actuators. A little bit, students don't like it as much because you need a lot of tweaking here and there, but they do the job. They stimulate the materials, and that's what we want. We want to stimulate the materials. So feel free to email me. I'll be happy to share those with you.
Grad school is about tweaking instruments.
Yeah,
so.
exactly. Customizing the rigs and so on. So
that's a better word.
Yeah.
Customizing. We had 2 questions from Varun Solanki, and I think one was covered. Varun had asked if there was any work done on self-healing composites, and I think that question came just before you hit that very nicely. So the second question I'll focus on instead, which said, could bone or bone substitute be used as a tooth-colored filling material?
Interesting.
If we have adhesive system between the prepared tooth structure and the bone-containing restorative material.
Very interesting question. Yeah.
It came on the edge of, I think, what you talked about, but what's your perspective?
Yeah, just here thinking quick thoughts. So I think it's great. One advantage of bone is biocompatible, can have an architecture which is similar to dentin, which is great, similar mechanical properties. So in that regards, I see positive. Like some challenges I see forthcoming is sterilization, right? Are you getting bone from bovine or from humans? Then you need to sterilize. Is now your host, your patient will accept that. Also, you want to kind of clean it up. Also, during that cleaning process, some of the time you lose the minerals, right? The bone again is collagen and minerals. Sometimes when you sterilize, you remove either the minerals or the collagens, depending how you do it. So if you lose that, you might lose architecture, you might lose the materials, and then you might lose some of the properties you were initially looking for. So as everything in life, I see positive aspects and challenges that we need to overcome. But it's a great idea.
Yeah, and we have another comment and question from Spiro Magremis, I think. Nice talk, Santiago. Spiro shares. Have you found a trade-off between the filler contact or strength in parentheses and the ability to inhibit film growth? Are you able to get uniform distribution of your particles. And I was wondering something similar about the impact of particle size and maybe even shape on those piezo structures.
Great question. Yes, indeed. This is a parameter. I show you just here, but we have, yes, we have seen a change. That's the answer. So we have tested nanoparticles from 200 nanometers down to 50 nanometers. We have tested salinized particles and non-salinized particles. And there is, and we have added the nanoparticles into adhesive only, and to the composite only, and to both as well. So think about the Excel sheets of the students, right? There are huge parametric studies going on. So short answer is yes, there is an influence. I can tell you that the last formulation that had worked for us, we're using 5% of BTO of, I hope the students don't kill me, the 50 nanometer version salinized, and we're using 40% on the composite side. And that seems to be the one that is giving us comparable results with the commercial. That's how we were able to equalize and get it up and running. But indeed, the shape, the salinization is important, and the amount is important.
Great, thank you. I do not see anybody that I might expect as your student typing objections, so I think you may have gotten it. So at this point, I think, given our time and our questions, I will pass it back over to Dan Lemire to finish, and we'll offer our thanks again to Santiago for a terrific talk. Thank you.
Thank you very much, Dan. Thank you very much. Thank you.
Santiago, thanks for a great presentation. Dan, thanks for moderating our Q&A session. Santiago, if I could, I do have one kind of perhaps remedial question for you. I wonder, is it, and forgive my naivete, is the electrical charge generated by this piezoelectric composite significant enough to be palpable?
To be what, sorry?
To be palpable, would you be able to feel it?
That's a great question. The honest question is we don't know because we haven't tested in humans. Could be because, the charges might be able to drive the dentinal fluid to activate the nerves. That can happen. We don't know. I don't know if the charge magnitude we have, actually, the less charge we have, the better the antibacterial effect. So we don't really need a lot of charge driving this antibacterial effect. Okay. But that can be something, and that's something we know, we're aware of. We haven't tested it. We should test it. We're going to test it. If you check back on me in 5 years, I hope I have a better answer for you.
Thank you very much. And again, thank you for a great presentation, Dan. Thanks very much for moderating. Before we go, I do have a couple of quick housekeeping announcements, if I may. Let me see if I can get my slides to advance here. Apparently not. Go into the application window, forgive me. Just wanted to let you know, SOP's special interest groups have been very busy planning webinars. We have some already available in the archive, and more are coming in the months ahead. For a complete listing of all our webinars, or to register or view the recordings, please visit biomaterials.org/webinars. The SOP annual business meeting is scheduled to be held virtually on Thursday, July 15th at noon Eastern. Attendance for the business meeting is limited to members only, so to register, please send an email to info@biomaterials.org. Nominations for award ceremonies and nominating committee members will be requested. Please be sure to check with any nominee to make sure they'd accept the position before making a nomination. I want to let you know the call for ideas for the 21 meeting, the deadline was yesterday, but we're not actually going to pull the data until 9 a.m. tomorrow. So if you have any ideas for 21 and you haven't gotten them in yet, you have perhaps a couple hours to get an idea in. The link is at the bottom of the SFP homepage, biomaterials.org. Also wanted to just let you know that we've postponed the joint symposium with the Japanese Society. It was originally to have happened in December, but that's now going to happen at the end of July 2021. And last but not least, if you haven't joined SFB yet, please consider doing so. And if you have, thank you very much for your support, and please encourage a colleague to join. That's all I have for today. Again, Santiago, Dan, thank you very much for your contributions. Have a great day, everybody.
Thank you, Dan. See you, bye.